All right, welcome. We are moving up to the knee. So hopefully you guys are coming to this video from the blog post that we've got, the Fix Your Posture Guide, and you've already done the toes, feet, and ankle exercises. This video is more specifically for the knee. Now, a lot of people have come over the years saying, my knee is screwed, I'm in a lot of pain, fix my knee. My experience often has been that the knee is not where the issue lies. It is stemming from something that is wrong in the ankle or the hip, and they are just feeling the pain in the knee. So it's very important that you go and see a health professional, get them to diagnose where the imbalance or the tight muscle or the muscle that's not activating is coming from and why you are experiencing that knee pain. Don't go straight to just blaming your knees. It's not old age, it's just that something's tight, something's not activating properly, or something's not strong enough. So that is why you are experiencing this discomfort in your knees. But we're gonna fix that today. I'm gonna show you how to do it with just, if you have no equipment and it's just body weight. Otherwise, we're gonna use a pretty strong resistance band if you do have your hands on one of those, and give you variations from there. So the first thing we do in our sequence is obviously release the muscles around the knee and make sure that everything is as lengthened as we can get it. Not only that, that between sides they are as long as possible so that we put it in the best possible position to activate and strengthen. Now, the muscles that we're going to be focusing on are the quadriceps, the muscles on the front of the legs, the hamstrings, the muscles on the back of the thigh, and the gastrocnemius, the calf muscles. Reason being, the calf crosses the knee at the back, so that can be affecting the knee joint through there. The hamstring crosses the knee at the back also, and those two actually cross each other. And then the quadricep being the other one that joins onto the patella there and crosses that knee joint as well. So loosening up those three muscles are vital to making sure that we've released any muscles that might be tight. Now, the hamstring, doing this, I like to just standing up, just find an object that you can comfortably go to and just raise the leg up on top of it. Now, key thing here is making sure we keep that knee bent a little bit and you are just hinging forward from there. So we're just lengthening that hamstring muscle and just go to a comfortable range and just feeling that lengthen out through there. Once you've done with that bent leg, you then want to make sure that we're not missing any of those hamstring muscles and lengthen that knee out. So straighten the knee, don't hyperflex it. You don't want to feel it pushing too much on the back of that leg, but just making it a little bit straighter and hinging down. You can use your arm as like a point of reference. Just slide down your shin. That's going to help you between sides know if one side's tighter than the other. If you can reach your foot, then obviously that's a great way to do that way there. And just coming down, stretching that hamstring. So once you've done the tighter side or one side, switching it over, and you just want to check that they feel the same. So the biggest thing that we're looking for here are just imbalances between sides, because that's going to be an identifier as something that can cause joint pain through there. So once that's feeling released, straighten that knee out, coming down as far as you can. If you can grab the foot, do so. You don't want it to be uncomfortable. You just want to feel that stretch happening. Loosening your muscles out and just breathing through there until that you feel that has stretched out. Now, if that's too uncomfortable, there are other variations. You can do it standing. You can literally just hinge forward and stretch out the hamstrings that way. You can use a wall. So a lot of the times we will get clients to lay on the ground and have their foot up on a wall to stretch that out. It's much easier to do that on a corner, say with your leg shooting down on a post, and just use that to stabilize it that way. You can obviously do it sitting down as well if balance is an issue standing up. Many options to be able to do that. Once we've loosened out the hamstrings, we're going to move on to the quadricep muscles. So holding onto a stable object for balance, as we said before, lift up that leg, grabbing the foot, and you're going to pull yourself straight with the aim of getting your knees together and that knee and hips are in a straight line to your torso. Pulling that heel towards your glutes and feeling that stretch running up the front of your legs. And we're just gonna hold there. You're obviously feeling for how much that's stretching, what position you can maintain and hold through there. If you're feeling like that's not quite getting enough stretch, I'm just gonna face backwards so you can see, you can use the opposite hand to pull and come through from there. And that's gonna get a little bit deeper of a stretch through there. And you just hold that, balance out. Once you've done one side, we then check the other side and make sure that they are feeling the same. Now it's very important, I see a lot of people here, they will like have their leg out like this, or they'll have it forward. So we're not creating that length through the quadricep muscle, therefore it could be tighter than you think. So making sure we're really lining it up, pushing those hips forwards by engaging that glute and getting a good stretch through the quadriceps, loosening it out, releasing everything, making sure it's ready to activate. And we come through from here. Fantastic. All right, and then this last one is the gastrocnemius, so the calf muscle. And I say that specifically because the back of your leg, we think calf muscle, but you can see here there's two. So this big ball of muscle here is the gastroc. That's the one specifically we are going to be stretching, because that comes over the knee joint and can create damage there. The other one is your soleus. So some people will be stretching their calf and they're feeling it down here. If you're feeling it in that lower portion of the lower leg, that's not where we want it to be. We want you to be feeling that stretch in that upper calf, just behind the knee or a little bit lower, okay? How we do that is we stretch our calf with a straight leg. That's gonna help us get that stretch through there. So you can lean on a wall or on the objects that you were doing the hamstring on. I'm gonna be working on this one first. So I'm taking that foot far enough back that I don't think I can get my heel to the ground. Then I'm just going to push my weight into that foot. So if you see, I'm really leaning in those hands and that foot, and I'm trying to get my heel to the ground. And I'm just gonna push that towards the ground. Now, here you should be feeling the back of that calf muscle really stretching, really lengthening out. If I was to do this with a bent leg, that would get lower down on that soleus muscle that I was talking about before. That muscle doesn't cross behind the knee, so it's probably not the cause of that knee pain. We want to make sure we're getting that upper calf muscle, the gastrocnemius, and really lengthening that out as much as we can. Once that's feeling like it's gained some length, it's relaxed, it's gone from there, you want to change sides with the aim of getting them to the same length and feel. If you are feeling an imbalance in any of these three stretches, just repeat on the side that is tighter or more painful until you do have them evened out. But that is a surefire sign to show that that is a cause of your pain. So imbalances between sides are a main contributor to joint pain. Just relaxing that out before we move on to activating all of these muscles. Now, we're not going to worry too much on the calves because we've activated those in that ankle sequence that we did previously. If you haven't seen that, you can go back to that video and add that into this routine. But I'm going to show you specifically how to activate the quadriceps and hamstrings. And keeping it as simple as possible, I like to stand up for this first one. Now, the hamstrings first, similarly to the quadricep stretch, except we're just going to manually move the leg ourselves. So hold on to an object for balance, so you don't have to worry about that. We're going to be working this hamstring first. Keeping those knees together, I want you to actively move that heel up towards your glutes and just bring it up as high as you can. You will feel that hamstring muscle shortening, pulling that leg up off the ground. Come up, hold for a second, drop it back down, and do anywhere from 5 to 15 reps of this just to activate those hamstring muscles through there. So flexing that up and then repeat on the other side. Same repetitions, coming there. Once again, you want to be feeling it in the same areas. You want to feel that your performance is the same. So what I mean by that is you can get your heel to the same height on the other side. If you're like, oh wow, that's as high as I can get it, then that's an activation imbalance between sides, which is probably causing pain. So Bringing that up, activating. You want it to feel the same. It could even be a stamina issue. So as you move through the repetitions, does it feel like it's fatiguing faster? Things like that. If you do notice any of those, then once again, go back to the side that you noticed was tougher, was harder, or you didn't have the range, and give it some extra reps to let it catch up over time. So that's how we're gonna work on activating the hamstrings. And if you have no equipment, the way we're gonna do the quadricep to help the knee is sitting on a chair where your lower leg cannot reach the ground, so it's just floating, so you can get that good range through there. And we're just gonna practice a leg extension without any weight. So the lower leg weighs something. So even us activating the quadricep muscles to hold that leg up there is still gonna apply some load and help us activate that muscle. So keeping nice and tall, just tensing that leg, making sure we're not swinging it up. You're feeling these muscles actively pulling on that patella there, which is pulling that lower leg up. And I recommend anywhere from 10 to 25 repetitions of this. Just coming up, holding at full extension, tense that quad, those quad muscles as hard as you can, and guide it slower than gravity will take the leg down back to that starting position. So once you've done that on one side, doing the same repetitions on the other side, once again, checking that you get the same activation, that it feels at the same difficulty level, and as the reps accumulate, that it's not getting more fatigued than the other side. They should be very similar. Okay. One thing I do want to point out is when doing this exercise, making sure that the toe is not turning out. So when you bring your leg up, if you find that your toes are fanning out and they're not vertically stacked with toes and heels in line, then that could be an issue as well. So that can be an array of things, but making sure the toes and the heel are vertically pointing up towards the ceiling, heading in that direction that the knee is facing, and working through there. But ideally, we can get ourselves some equipment. Now, what I would do here is place a band a little bit higher than knee height. You don't want to go lower than knee height. And what we're going to do here, you will be stepping into the band, and this is going to help us put a lot more resistance on that knee, on the flexion of our leg, and help keep the tracking in motion. But more specifically, really help us feel and activate that VMO muscle, which is often a cause of people having weak knee joints or weak knee extension. So you are going to walk yourself back once you've got that behind the knee as far as you can before it really starts altering your position. Once you've done that, the weight goes through the other leg. Bring that foot back even further so that you're up as high as you can on those toes in a toe sit sort of position. Relax that knee out, let the band pulling it forward, but that foot is planted on the ground. From here, make sure we keep facing where the band is tied to, and you are going to push, extend that knee, which pushes that heel towards the floor until that leg is tensed and straight, and you hold for 2 seconds and then slowly release. Go again and slowly release. Go again and slowly release. Now, you want to keep doing this for 25 repetitions. So if you've gone back a little bit too far and you overdone yourself, bring it in. It's going to be a little less resistance, and just work at a range that you can maintain the stamina for 25 repetitions. And as you get stronger on both sides, with them both being equally, you can work on going further back to add more resistance through that band. So it's very important to take note, have a landmark on the floor of where you are standing, so when you do swap sides, your feet are in the same position. The worst thing you want is to be doing it this close when it's on that leg, and then you put this one on and you're standing back here and you go, oh, this one's harder. So we want to make sure we have the same distance away from where it's tied to, so that we can guarantee that we've got the most similar resistance pulling against both sides. And same thing on the other side, you're tensing, hold for that 2 seconds, slowly release it out. 25 repetitions. It's a lot of repetitions, but they're very tonic muscles there at the front, the quadriceps, so they need a lot of repetitions to be able to activate and stimulate through there. If you can get through that very evenly, you didn't find any issues there, then that's probably good. And this would be going back to what I said at the start, and it's probably not the knees that are the issue. There's something either at the ankle or at the hip that has the mobility, the strength, or the activation issue, and that's why you're getting the knee pain. Lastly, we're gonna move on to a strengthening exercise for the quadriceps and that knee joint. That is my go-to bodyweight exercise to activate those, and that is curtsy lunges. So to perform a curtsy lunge correctly, if you just stand facing straight on from there, imagining that the king is in front of you and you are just going to curtsy to the king. We are gonna cross. If I do my this leg first, I'm going to bring my other leg around on that angle behind me. That then rotates my femur bone, but I'm going to keep that knee going down on that angle, trying to drop my other leg's knee to the floor, keeping as upright as I can, push through that front leg to come back up, bring my feet together. So the reason I love this so much is it's putting the knee through an angle it doesn't generally get to work through. So you're training this joint through some really rough ranges of motion and getting it strong through there. Now I recommend 10 on each side, so just alternating through 20 curtsy lunges and just work through a range that you can comfortably do. If you do get knee pain and you get to say this position and it starts to hurt, then just come up a little bit higher and just work through the range that you can maintain pain-free. There's no point in moving through any painful positions here. That isn't going to help. We want to get the body as strong as possible, working through the range that we have. And over time and over repetition of this routine, let that increase to a point where we have no limitations and your knees can lengthen through there. Now, obviously, there is a plethora of other exercises you can do, but these are my go-to. That is the most simple for most people to do and be able to develop pain-free, strong knees. Enjoy.